Hello. Together for Her is a digital care program for pregnant women in India that delivers personalized antenatal journeys and helps improve maternal health outcomes. And I'm proud to say that Together for Her has reached more than 350,000 pregnant women and helped support them in their pregnancy. And this impact goes beyond scale. Our research has shown that women on Together for Her have improved health literacy and health behaviors. And it is this impact that underscores not only the potential of Together for Her, but differentiates our approach. Because at Together for Her, we marry data science and behavioral science to create personalized care journeys for pregnant women that are crafted with the goal of improving their health outcomes. I am immensely thankful to the Commonwealth Digital Health Awards for recognizing the work that we do, but also being our personal champions and proactively engaging with us and supporting us so that Together for Her can become a global digital care program for pregnancy. Thank you.
Hi, I'm Kirti Kottu, CEO of Gender Innovations. Do you know the cardiovascular diseases are the #1 killer of this world? But we can save millions of lives and billions of money by detecting this condition at the early stage. Endothelial dysfunction is the earliest possible stage to detect this condition. So as a team, we have developed a technology to identify this condition at the early stage, and we have patented it in US. So as a team of engineers and doctors, we are planning to launch this product to the world very soon. Commonwealth Digital Health Award is a platform for the companies like us to reach the world and raise the awareness.
Hi everyone, I'm Sharmin Somasundram, co-founder and CEO of Niftron. Niftron is a blockchain as a service platform that allows businesses and organizations to easily integrate blockchain with their products and services, which will allow them to build products which are more trustable and with high privacy, security, and ownership with their clients or customers. The differentiators or the uniqueness in Niftron is we made Niftron in a way that it can work as a blockchain agnostic model where users can able to connect with multiple blockchains at the same time. And it comes with the inbuilt cross-chain feature, which allows users to transfer assets or else transfer projects or migrate projects between two blockchains. And the way that we architecture the Niftron is one of the other uniqueness because we architecture the blockchain in a way that users can build blockchain applications in a correct manner without having the full expertise and knowledge.
Hi, I'm Tarundu from F-Code Labs. F-Code Labs provide AI-first digital transformation solutions to organizations. We also provide tech startup consultancy. We help them build their products, set their technological roadmap, incorporate the aspects of AI into their roadmap, and help them grow their engineering teams through our remote teams. We also help organizations, especially in USA and Europe, to grow their engineering teams with our remote teams. We have been working with some of the largest Sri Lankan organizations as well as Ministry of Health Singapore for a long time now. And by participating and winning Commonwealth Digital Health Awards, we want to form right connections and right partnerships so that we can exponentially grow our business and our brand inside USA and Europe. Thank you very much.
Introducing MagicBit, an easy IoT platform for everyone. With MagicBit, you can develop your first IoT project in less than 10 minutes. MagicBit may look small, but it's a powerful tiny computer powered by ESP32, packed with onboard features. If you need any additional sensors, you can simply plug and play. With our cloud IoT platform, you can create IoT projects easily in minutes, even without coding knowledge. You can also program MagicBit with your favorite language. It can be easily connected with cloud IoT platforms. Since MagicBit supports many platforms, basically, you can try out any related resource on the internet with MagicBit. How about using your mobile as an input or output device for your next IoT project? With our mobile app, you can get sensor data from your mobile and send back notifications. When COVID-19 pandemic struck the world, millions of students were stuck at home, and their interest in technology was directed towards computers and mobiles. MagicBit is a perfect STEM tool for students to learn new things and improve creativity with innovation. It's made for everyone.
My name is Brad Chesham, and I'm the founder and director for Bundle of Rays. I'm also a nurse, and this is what we focused on with Bundle of Rays. We're providing the future of e-learning for nurses globally. Forget about sitting around clicking on a screen doing boring education. We're able to give you learning experiences in literally a whole new world. What impact can we have? Well, there's 28 million nurses globally. 80% of the world's nurses are found in countries that account for half of the population. We can have a significant impact, and we can reproduce this business model into medicine or physiotherapy, all of the multidisciplinary facets of healthcare. Nursing education has changed. Bundle of Rays is helping to change the nursing world.
This is our classroom. We can connect nurses from Sri Lanka to Australia, all across the Commonwealth, and we can put them into different environments, and we can literally immerse them in the content and engage them to get results. Can't wait to share it with you.
Good morning, good afternoon, and good evening, everyone. Welcome to the first in a series of webinars organized jointly by the Commonwealth Centre for Digital Health and the Princeton Frugal Innovations Accelerator in view of the upcoming Commonwealth Digital Health Awards. I am Pandula Siribaddana, the convener of the Commonwealth Digital Health Awards. Now, the objective of today's webinar is to discuss how a startup or an innovator could benefit by becoming part of the Commonwealth Digital Health Awards, and even if they do not win an award. Now, during this webinar, please post any questions that you may have into the chat, and we will be able to take them up during the Q&A session. Now, before we proceed with the discussion, it is a pleasure for me to introduce our panelists for today's webinar. We have Professor Vajira Disanayake. Professor Disanayake is also the chairman of the Commonwealth Centre for Digital Health, and it is his vision that made Commonwealth Digital Health Awards a reality. Professor Disanayake is also the chair and the senior professor of anatomy, director of the Human Genetics Unit, and the chairperson of the Specialty Board in Biomedical Informatics of the Postgraduate Institute of Medicine of the University of Colombo. Professor Dissanayake is a pioneer in genetics, genomic medicine, biomedical informatics, and bioethics in Sri Lanka. And he is the past president of Sri Lanka Medical Association, Commonwealth Medical Association, and the Health Informatics Society of Sri Lanka. We also have with us today Mr. Barry Rabner. Mr. Rabner is the chairman of the PFIA, and before serving in this position, Mr. Rabner was the president and CEO of Penn Medicine, Princeton Health. Before joining Princeton Health, Mr. Rabner was senior executive at the Jefferson's Health System's Mainline Health and Moss Rehabilitation Hospital. Mr. Rabner serves on the boards of Rider University, the Center for Healthcare Design, RISE 360, and several community organizations. He is recognized as one of the most influential executives in healthcare and business in New Jersey and speaks on healthcare-related topics throughout the US and internationally. We also have with us today Mr. Tony Singaraya. Mr. Singaraya is the founder and CEO of Princeton Frugal Innovations Accelerator and co-founder and chief commercial officer of the Commonwealth Centre for Digital Health. He is a founding partner of Analogy, a boutique strategy consultancy that in 1997 pioneered and has deep expertise in business model design that optimizes risk, reward, accelerates rapid commercial scalability and ROI from breakthrough products and services. He is an advisor to Johns Hopkins Center for Biomedical Engineering Innovations and Design Groups, and previously held various roles at Johnson & Johnson over a 20-year career, including as Worldwide Executive Director for New Category Development and Business Model Innovation. We also have with us Mr. Anup Singh. Anup Singh is a technologist who specializes in innovation, data science, and analytics in healthcare and financial sectors and has extensive experience working on technology-led innovations, development programs, predominantly across the Commonwealth countries. He is currently the Chief Operating Officer of the Commonwealth Centre for Digital Health and has worked at national and regional level with governments of the Commonwealth, international organizations such as United Nations, WHO, ITU, and the European Commission. You realize the wealth and knowledge of expertise and the capacity within the panel that we have been able to gather today. And I'm sure this is going to be a great and an informative session. Now, as you know, Commonwealth Digital Health Awards is into its 5th iteration. And knowing the purpose of setting it up would be therefore useful for us to build a foundation for today's discussion. And what better person than Professor Dissanayake to provide us with this insight? However, unfortunately, Professor Dissanayake is not able to join us in person. But I posted the question, what was the reason to establish the Commonwealth Digital Health Awards? And this is what he had to say.
Good day, everybody. I would like to begin by welcoming all of you to this special webinar on accelerating your startup journey with the Commonwealth Centre for Digital Health and the Princeton Frugal Innovation Accelerator. The Commonwealth Centre for Digital Health has its origins in the Commonwealth Digital Health Initiative that we launched in 2016 as the flagship project of Sri Lanka's presidency in the Commonwealth Medical Association. I had the fortune of giving leadership to that initiative as the president of the Commonwealth Medical Association. When we began the initiative, there were 2 main events that we were focusing on. The first one was the Commonwealth Digital Health Conferences. The conferences were aimed at creating an awareness and disseminating ideas. The second event was the Commonwealth Digital Health Awards. The Digital Health Awards were established with the idea of recognizing frugal innovation in the Commonwealth and beyond. Today, we are now into the 5th year of these awards, and The awards, the number of awardees, the number of submissions that we get for our awards, and so on, has kept on expanding. At the same time, there have been several partners who have partnered with us along the way. This year, we are working closely with the Princeton Frugal Innovation Accelerator, and we hope to strengthen that partnership with the Princeton Frugal Innovation Accelerator to help those who are innovating in the field of digital health accelerate their innovations and take them to market. I hope that all of you who are participating in the webinar today would benefit from the ideas that we are sharing with you, and will go the entire journey with us and take your ideas and your early innovations to market through our partnership with the Princeton Frugal Innovation Accelerator. Thank you very much.
Thank you, Sean. I think it's clear from that what was the purpose in setting up the Commonwealth Digital Health Awards. And we also know that it has grown from strength to strength over the years. And I remember that last year we got submissions from more than 30 countries, and that basically illustrates how widely it has been accepted at the moment. Now, for us to understand the benefits gained by the applicants of the Commonwealth Digital Health Awards from this year onwards, I would say, it would be useful for us to know about the Princeton Frugal Innovations Accelerator. And let me ask this question from Barry, and perhaps Tony could also join in. What is PFIA and what is its purpose? Barry?
Thank you. Actually, we heard a good summary of it just a minute ago, but the Princeton Frugal Innovation Accelerator really exists to partner with innovators like the people we saw at the beginning of this program who are working to improve the health of people in developing as well as developed countries. We have a global team with expertise in science and medicine, digital technology, artificial intelligence. We also have experience in designing business models to commercialize innovations and have access to the capital necessary to discover, develop, and deliver low-cost products and technology. Over the past 5 years, the Commonwealth Centre for Digital Health has found hundreds of outstanding ideas with the potential to improve people's health. The PFIA's role is to help the best ideas be commercially successful. When we become your partner, we begin by learning about the work that has been done and assessing its market potential. For the best ideas, we help develop and test prototypes, design effective business models and marketing strategies, and secure capital, all at very low costs. You can learn more about the PFIA and the people associated with it and explore how we could work together by contacting the organizers of the webinar. I'm very much looking forward to meeting you and your teams and working with you. Thank you.
Tony, do you want to add anything to that description?
No, I think that was absolutely fine. So thank you, Barry. That was nicely done. And Prof. Vajira, I know he's not present, but thanks to Prof. Vajira as well. Thanks, Pandu.
Thanks, Barry. I mean, that was an excellent explanation of what PFIA is and its purpose. And from what I have mentioned, Barry and Tony, what you have mentioned, I feel that both the Commonwealth Centre for Digital Health and the PFIA has a shared vision, isn't it? And this may have been the reason for this partnership. Now, the importance of that, as I see, is that it differentiates PFIA from any other investment fund or a venture capital firm, and that highlights this particular partnership. Now, moving on to the different topic. Now, this question goes to Anup. I think Anup is here. Anup, a feature of Commonwealth Digital Health Awards is its focus on non-medical tech, such as edutech, fintech, ecotech, etc. Now, one might wonder why a digital health awards would want to focus on non-medical tech. Can you please give us an explanation and a reason for this particular approach? Anup, I think you are on mute. You have to unmute. Yeah.
Okay, so I failed the first digital test, turn your microphone on, so that's
We
doesn't
can
bode
hear
well,
you
does it?
clearly.
So yes, I'll try. So the bottom line is, so we focus on medical. So this, given that the Commonwealth Centre evolved from predominantly the medical space, it was inevitable that we would start there. But if you look at digital innovation is cutting across every sector and every aspect of our lives. So, I mean, the innovations, and also they come from various places. So if you think about it, they'll come from education in the form of MOOCs and all sorts of things. Historically, there'll be innovation from the defense sector, from the logistics sector, from the telecom sector. And every element of that, many elements of that come together to deliver benefits in the health and care space. So it's quite hard when you're looking at any one sector to isolate out and say this is purely medical innovation. Now it's somewhat easier to do if you're looking at something like sequencing a gene or vaccine discovery, but even that's using AI techniques that have evolved from other sectors. So one of the reasons we do that is we've found from experience over the last few years, and I think we've got plenty to learn still, that we're getting some great submissions coming in from the education sector, for example, or from the finance sector around digital innovation that can be repurposed, adapted in ways that benefit the health sector as well. So that's broadly speaking why we're looking across the board. It isn't to say that we're looking necessarily for solutions that are at the moment, where they're focused on improving the container logistics around the world, which is another one, because if you look at that, there's some amazing digital innovation in that space around IoT and how they handle containers and the chill chain and so on. Much of that can be repurposed, as it has been, for the more efficient and safe delivery of vaccines. So there's a lot of cross-sector innovation that comes together that can benefit the medical sector, and not just in pure conventional definitions of medicine, but in the broader sense of health and care and well-being, and enabling universal health coverage. If you think about the ability for people in distributed and remote areas to be able to pay for care, and that's where mobile technology comes in. So a lot of that stuff comes here. Hence, sort of a rambling answer as to why do we look across sectors, is because we don't know where that nugget of innovation is going to come from and how it combines with other things.
Barry, do you want to add to another?
Yeah, just to amplify on that, I think we've all become much more knowledgeable about the impact of social determinants of health on people's health and well-being. And medical care is probably the most expensive of all the solutions that are available, and compared to others, often not nearly as impactful when you look at populations. So when you think about housing and education and employment and access to care, the ability to address those things in a way that will impact people's health is equally, if not more important. It's just not the traditional focus of the healthcare system.
Actually, Pandal, I'll just add, I know that we've got a friend and colleague of mine on listening to this, and they've got an organization where they've got some very innovative software that's been developed in the defense space. A good example, I know a lot of time and effort and money has gone into that, and it's validated. That sort of highly secure, it's in the IoT space as it happens, but it's by the by. But that sort of innovation, where a lot of thinking and trials and testing has gone in another sector, that is a very fastidious sector. It's got high standards. You can imagine what the defense sector is like. If you look at what's happened with drones and zipline for delivery of blood in Africa, you can see that identifying those sort of things and then saying how can they be brought to bear in the broader medical space is of huge value. So there are many examples of this.
Anoop, the best example I could think of what you just said is the origin of proton therapy, which was originally developed for military uses.
Indeed.
Yes. Yeah.
Mm-hmm.
I think, this probably explains a lot about why the Commonwealth Digital Health Awards focuses broadly on multiple aspects, not necessarily limiting itself to medical tech. And I think it also aligns with the WHO and other health organizations moving towards this social determinants of health, as Barry, you pointed out, where everyday aspects like the economic condition, the level of education, ability to gain employment or save money, or be able to keep the environment clean or be in a safe environment, all these contribute to somebody's health and well-being. And therefore, I think what the Commonwealth Digital Health Awards has done is to bring these ecosystem components together so that it can have a broad implications. And I think, thank you very much for that insights on that aspect. Now, the burning question, as far as I'm seeing, with regard to the Commonwealth's, based on this particular unique partnership between the Commonwealth Centre for Digital Health and the PFIA, is that what startups and innovators, what can startups and innovators expect by applying for the Commonwealth Digital Health Awards, not only during the awards, but also after the event? Barry, would you like to go first on that?
I'm going to defer to my colleague, Tony, to go first, and then I'll...
Okay, sure. Tony. The question is, what can startups and innovators expect by applying for the Commonwealth Digital Health Awards, not only during the awards, but also afterwards?
Sure. No, thank you, Pandula, for the question. So, on the question of social determinants of health, I just want to touch base on that for a little bit. For the last 15 years or so, I've had the good fortune to spend about half my time in the US every year and half my time in Asia, Australia, Europe, and so on. And everywhere I go, I've been struck by the abundance of innovation. I mean, there are some really smart people with wonderful ideas out there. And what they confront, however, is a series of extremely difficult challenges to take their idea and make it valuable and useful to many people. What we want to try to do is to make that journey over these difficult hurdles a lot easier. Now, the hurdles include designing the product well. It includes proving to people who need proof that your solution actually works. It includes getting the money you need to do the development work. And as you know very well, as startup people, every day matters, right? I mean, you're sort of burning the midnight oil, you're burning the candle at both ends, you're exhausted, and it's exhilarating and exhausting at the same time. What we need to do is to try to help innovators get to market better and faster. So that's what you can expect in general terms. Now, in terms of practical experience, we have been running the Commonwealth Awards once a year. What we intend doing going forward, potentially, is having more than one set of awards through the year, maybe 2 or 3 submission rounds. And these might focus on different topics. For example, we may have theme-focused innovations in education that supports healthcare. We might have a different set of awards for women in science, and so on and so forth. Now, once you win an award, or even if you don't win an award, but do submit your idea for consideration, what we have through Barry and Anup and others is access to US and other investors who both have good hearts and good minds, and importantly, heavy wallets, right? These are people who are interested in supporting innovation that is designed well, and they want to get these solutions to market quickly. So in terms of after you win an award or after you make your submission, the first gate is the judging process, and we're going to talk about the criteria in a bit. After the judging process is finished, and you get a nice pat on the back and a certificate saying, well done, you won an award, there's a whole series of steps that we will talk to you about in more detail later on. But basically, it is trying to get your solution to market faster.
Pandila, you're muted.
Can you hear me now? Yeah,
I can hear you.
Yeah,
we can hear you.
So thanks, Tony. Now it's very clear, like benefits of applying and getting into the funnel, if I may say it. And in other words, Commonwealth Digital Health Awards, as you said, probably is the main entry point to this funnel. It was also notable that that when you said even when applicants does not win, the chances of being considered for the PFIA support remains high. And I think that's an important element, because not everyone will be able to win an award because it's limited. But that does not mean those innovations are being discarded, because those probably will be attracting, maybe impactful in so many other ways that we probably will not think of at one particular point. Now, the pathway may extend beyond the awards, therefore, and getting into this pathway early may be a good idea for many of the startups and innovators who are present here. Now, last but not least, one of the key concerns for any startup or an innovator is how should they pitch their products at the Commonwealth Digital Health Awards and be successful in entering the PFIA funnel. Now, Tony, if I may ask you this, what key areas are looked at by the Commonwealth Digital Health Awards and the PFIA when identifying winners and potential candidates for PFIA support?
Yeah, thanks, Pandula. Could I ask for the first slide to be put on the screen, please? Thank you very much. So, this is a really critical question, because one of the things we found is, so let me back up a little bit. The goal of the Commonwealth Centre for Digital Health, and it's in the partnership with PFIA, is we want to find 1,000 innovative ideas a year. Now, in every round of innovation that we seek, we get about 300 ideas coming in, which suggests that we need to run the awards process more than once a year. But when these 300 ideas come in, what are the filters that are used to help us figure out which are the winning ideas that come in? And while there are many factors, I'd like to say that the 6 that you see here, I'll talk about these a little bit, but the 6 that you see here are sort of the key lenses we look at an idea through, and each of these factors then gets a score. Let me go through the factors. So the first one asks, does your solution solve a serious problem that affects many people? So for example, if you have a solution that affects 100 million sufferers a year, it's a big, important solution. So think about it as how important and impactful is your solution. So obviously there are conditions like diabetes. Unfortunately, we've seen the effect of something like COVID and so on and so forth. How serious a problem are you trying to solve? Point 1. Subset 2 of that, does the serious problem affect a lot of people or a few people? So that's the first point that we look at. The second point we look at is, okay, so, when we develop something ourselves, we sort of fall in love with it. It's our baby, and we really believe that it works. But what is the quality of proof we have? What is the evidence we have to show others that our solution really works? So for example, some solutions might require a clinical trial. If it is not a medically oriented solution, it might require proof in this form. There's a lot of people using it, and based on user reviews, they really find it useful in their life. The question goes back to, what is the quality of evidence you have that the innovation you have is actually working well? The third is an element of newness. What is new in how it gets the job done? So for example, Is it a novel way to solve an old problem, sort of a new way to solve a known problem, if you will? Or is it a new way to solve a new problem, which is even tougher to do? How new is it? And we want to see what factors really are new in this solution. Try to be really clear to tell us, these are the 3 things that are really new and different about my solution. The 4th thing is, newness is great, but is it actually doing the job any better? So superiority, it's rare to find a problem, especially a meaningful, important problem, that doesn't have some kind of a solution already. Some of these solutions may not work very well. And so the question is, item 4, superiority. How can you explain to us what's better about your solution than others that exist today? The 5th is something that's extremely important to the Commonwealth as well as to the Princeton Frugal Innovation Accelerator. There are a great many useful solutions in the world that 90% of the world cannot afford to pay for, right? 90% of the world not being able to afford a treatment is criminal. And with digital technology, precision medicine, the web, data analytics coming up to be really valuable and useful elements of a solution, what we find is that affordability is extremely valuable because you get to solve the problem for a lot of people. So ask yourself, does your solution dramatically reduce the cost of delivery of this solution compared to alternatives? Can a lot of people in emerging markets easily pay for this? I ask myself, can a person from a village in Sri Lanka pay for this solution? And if the answer is yes, that's what gets a good score on item 5. At item 6, the value of digital technology and data analytics, obvious to everybody, but what we're looking for really is signals that if your solution relies for its efficiency and effectiveness on digital technology, it tells us 2 things. One is that personalization becomes much more practical. You can use data to personalize a solution, so it's not one size fits all for everybody, but a solution for me versus for Pandula versus for Barry can be designed differently. The second thing that becomes interesting to consider is that fully being aware and respecting the privacy of health data, we can still find ways to anonymize the data and monetize it. So your solution becomes more valuable if it relies on data analytics that can be monetized while respecting individuals' privacy. So let's say you've submitted your innovation. What happens, next slide, please, Shamik or Pandula. What happens is, this is what it looks like after we've gone through our scoring process, right? So we score on a score of 1 to 5. And in this case, function gets a 4. Innovation and superiority, your solution is really great in terms of being new and better. Proof, there seems to be a need for more proof. Item 2 doesn't have a great score yet. And that's where the PFIA might be able to help you design ways to prove that your solution actually works. And item 5 and 6, there looks like there needs to be some fine tuning because it's not got a green yet. It's not red, but it's not a green either. And again, in those areas, PFIA might be able to help you redesign the product, tweak it to get better scores in those areas. So Pandula, hopefully that gives a sense to the participants in how we look at scoring ideas. And this is, let's assume also that the scores that you saw, a hypothetical example, of course, but assume that the scores that you saw did not let that solution win an award. It's an example of, even if you didn't win an award and your idea is really considered valuable, that's another area where PFIA and the Commonwealth are very interested in helping you improve the scores that you already earned. Thanks, Pandula.
Thank you, Tony, for that very clear explanation of how the scoring takes place and what are the key things that that Commonwealth Digital Health Awards and the PFIA are looking for. And it for me, when I look at that, what I feel is that it's not only a formula for the success in the Commonwealth Awards or, getting the support of the PFIA. That is true for any innovation or the tech that, someone probably would come up.
Thank you, Pandula. Just 10, 15 seconds more. So thank you for that comment, Pandula. It's extremely valuable. So obviously, we're students ourselves, so we're trying to learn from others who do this thing, this kind of judging well. What I can say is that those factors, as you obviously know, they're not unique to the Commonwealth or to the PFIA. They are, in fact, the factors that are used by the big corporations that look to buy your innovations, right? They are also fundamental to big business plan contests. I was, for example, I was a judge in the Wharton Business Plan Contest for 8 years. And these are the factors that these are the threads in how judges look at things. So what I feel is having a dashboard in front of your innovation that sort of helps you look at 6 areas of focus in everything that you're doing, because it's easy to get distracted, right? You're working 80 hours a week. It's easy to get distracted. Have these 6 things in sharp focus right in front of you. Get your teams and your attention focused on these 6 areas, and it'll improve your chances of succeeding. Thanks, Pandula.
Thank you, Tony.
I have a question.
Yes, Barry, please.
I have a question for Tony. Could you put the slide back on that has the 6 criteria?
Shamika, you can do that for us. Yeah.
So, I had the really the privilege to be part of the committee last year that was reviewing the ideas, and I'm wondering, given the significant number of people who don't have access to the internet, how to judge solutions that aren't digital that might be particularly effective in helping those folks? Do they lose points anyway?
No, I think Barry, yeah, no, it's a really good question. So there's a particular example in mind that comes to mind. It's an absolutely amazing innovation that scored extremely highly on items 1 through 5. And to your point, Barry, didn't do well because it had no data analytics, even though it had potential to get there. The team didn't have the money to build the AI system to handle the data. So while it got a high commendation in the awards, it didn't win an award. But immediately after the awards, they have become one of our primary partners. We're partnering with them to actually help them do 6. So the short answer is, if you don't have digital and data, it is a disadvantage in our scoring system, but it is a reason why we will focus on you if the other 5 areas get excellent scores. So we will partner with you even if you don't have digital and data central to your solution right now. Yes. Does that help, Barry? Is that?
Yeah.
Okay.
Yes. Thank you very much, Tony, for that explanation, Barry, for raising that question. And I can also point out that when applicants go through the application that is there in the awards website, they will probably see some similarity with the score card that Tony just described and the questions that are asked. So I will throw out another question, actually, since we have a little bit of time, to Tony or Barry. Now, of course, there are so many startups or innovators who are now looking forward to this event, and our deadline is in the middle of November, 15th November to be exact. How should they plan, Tony or Barry or Anup even? How should they engage and come up with the best application or the right pitch? What's the practical suggestions that you can make?
I think Barry and Anup have seen so many innovations come up. Maybe Anup, do you want to take that? And then maybe Barry could please contribute as well.
Sure. Okay, so look, there is guidance on the site on how to fill in the forms and apply, and not just on the site. Actually, since we're speaking of digital, if you go to the internet, there's plenty of guidance on how to put a pitch together as well. So that I think Tony or Barry mentioned it earlier. It's to date this process has been an annual thing, and we're getting 200, 300, 400, 500 applications, submissions coming through. I think the thing to bear in mind is this is not although there's a date in the sand for the digital awards, this is going to be a rolling process. So by all means, get in touch with us, put a submission in. Now the awards are a point in time thing, and they may be once, twice, 3 times a year, who knows? But actually the process for identifying and engaging with those entrepreneurs and innovators, and then connecting them through to the PFIA. Now I suppose the big announcement here today is that to date, it's been the digital awards, and now we brought together that with the PFIA. The PFIA is not a point in time thing; it's a rolling engagement program. So if you can get your submissions in for November the 15th, there's guidance on the site and there's other guidance available. If you're struggling, get in touch with the organizers, and we'll do our best to help. But if for any reason you feel that you simply can't get things together by the 15th of November, not a problem. It's an open rolling process. So that's one thing to bear in mind. Secondly, I'm going back to the slides. I'm not going to take you back to the slides, but to the 6 criteria that Tony mentioned. Number 5 was affordability in emerging markets. One thing I'd say there about frugal innovation is, getting frugal innovation that's sustainable, scalable, efficient. People talk about minimizing the cost. I look at it slightly different. I look in terms of optimizing the use of resources. Frugal in California is quite different to frugal in India. It's different to frugal in Malawi. So what do we mean by frugal? It's contextual. One of the things about that frugal innovation is also we're interested in, and Barry will resonate with this, identifying things that could be taken into what would be considered very developed markets, like America, for example, where something that's coming out of India or Sri Lanka or Africa or somewhere, wherever it's from, it could be that particular innovation can be adapted and scaled to deliver what effectively is highly scalable, frugal innovation and real benefit into a high-cost developed market like America, but in a different way that it would do it to an emerging market. So that's the point I wanted to make before I forget to make it. But the issue around submissions, there's stuff on the site, and as I say, it's a rolling program. So get in touch with us if you need help.
Thank you, Alan. Thank you, Barry.
Yeah, if I could add about working with PFIA, when I was listening to the startups at the beginning of the program, and Magic Bit was talking, I was smiling to myself because all of these ideas to me should start with the word magic, because they're amazing to me, and just how clever, just how smart the innovators are always stuns me. And but if the idea doesn't get to market and doesn't help people, it's just a shame. The benefit comes to the great idea from it being useful to people, and that really is where we come in. And I think the other thing that often surprises me is the folks who these brilliant people who come up with these magical ideas either don't have the interest or the time or the experience, or in cases more often than not, access to the capital in order to get it to market. So it's really, to me, it's just that simple. And those are the areas where we are expert. Certainly for me, it all falls in the category of magic, but when it comes down to the business of trying to get it successfully to market is really where my colleagues and I believe we can help. In terms of applying, I think it would be a crying shame for us not to have the opportunity to work with people with great ideas because we've put in place some complicated bureaucratic application process. I think all that matters is that they contact us through the Commonwealth, through the organizers of this conference, and have a conversation and let us understand, what you've accomplished and what you're hoping to do. And we'll start the process of figuring out whether we can help. And if you decide that we can, we'll keep going. But I would just keep that process very simple and not tied, temporally, not tied to the awards or any other activities that are going on. It's useful. The awards are useful in that it forces you to organize your thinking and your ideas and being able to present it, the kind of information that we would be looking for when we talk to you. But again, I wouldn't get all caught up in applications and a lot of process. Just let's start a conversation and figure out where to go from there.
Look, let me make a quick point.
Yeah,
just a very quick point.
Please.
I mean, I suspect some people will be thinking, so we've got the innovation accelerator. Let's focus on that word accelerator, because often, there's the two words that spring to mind is incubators versus accelerators. And a lot of what we've talked about here bridges across traditionally what would sit in one camp versus the other. I mean, the commonality there is that they're great ideas. So we want to identify great ideas with great teams. That's fine, great ideas. But if you've got a great idea, but you don't have a solid business model behind it, you don't have an MVP, a product working up and running at the moment, the founding team is small but could do with enhancement, and you need some capital, but not huge amounts of capital, then that's probably more on the incubator side of things, and there are things we can do with that. On the flip side of that, if you've got a great idea, that's the commonality, but you have got a good business model, or at least a functional one that can be enhanced. You've got an MVP up and running, and you've got a strong team, and you've got the potential for huge scalability and explosive growth, and you need a different amount of level of capital. That also we can work with. So whether you're more towards the incubator end of the services we can offer, or the accelerator end, do get in touch and go through the process, because we don't want to pigeonhole everyone to say, well, you must have a fantastic business model, because as to Tony's point, if you don't, then we can work with that. If you have the ability to capture data, but you haven't got the ability to grow out the analytics part of it, come and talk to us. We may be able to do things. So it's incubator versus accelerator. We span across the two.
Pandula, if I could just jump in for a second. So just to build on what Barry and Anup said, I wonder, Pandula, whether, in the past we've had requests from applicants for help in how to structure their submission better. If there is enough demand, I wonder whether there is a way for us to organize a separate, maybe 1 or 2 webinars that will actually be sort of coaching specifically around these criteria, so people can ask questions, like Barry asked, if we don't have digital, what should we do, and so on. So that's one point. The second thing that I will say is, building a startup is, as I said before, exhilarating and exhausting at the same time. I mean, there's so many balls that you're trying to juggle in the air at the same time. But what we've found over the last 15, 20 years that we've been passionately involved in innovation and startups is 2 things. Usually, the startup team is exceptional at the technology. You know what the problem is, you know how to solve it. It's really good stuff. The second click, though, that has to come in is the commercialization model. And from about 10 years ago, when the web actually began to transform business models, as you know, today, most of the huge companies are business model innovations, in addition to being technology innovations. What we find is many startups get an A in the technology and don't get an A in the business model. And these 2 circles have to come together. So if you have an innovation that's really great in terms of a technical solution, but you're a little bit concerned or a little bit worried that the business model is a little wobbly, it's a little shaky, maybe, Pandula, we could organize some seminars or webinars to help people with that topic. I just mentioned one more thing. Because I love startups and I'm sort of afflicted by startup disease. I have several startups that I'm involved in myself. And, you know, when I go to talk to investors, sometimes it can become a very depressing conversation because they seem not be able to focus on the good things you're doing, and they're able to focus so well on all the things that you're not doing, you know, so it can be quite a depressing conversation. We, the Commonwealth Centre for Digital Health and the PFIA, do not want the experience you have with us to be depressing. You know, this has to be sort of a joyful. I'm not suggesting that, you know, we won't have some questions also, but we don't want to be arrogant. We don't want to make the assumption that money talks and everything else that you're doing doesn't matter as much as money. This is meaningful stuff that the innovators are working on. We absolutely recognize that. And we want to respect that. Recognition is one thing, respecting it is different. We want to have both the recognition and respect for that. So come and join us on this journey. You know, I think spread the word, get your applications in, and we're looking forward, as Barry and Anup said, we're looking forward to working with you.
Thank you very much, Tony. I think that basically sheds light into what this Commonwealth Centre for Digital Health and PFIA partnership is all about. And that gives all participants as well as others a clear understanding of what involves and how a startup and an innovator should look at the Commonwealth Awards and be successful and become more impactful in terms of their innovations and how enhance the impact that they could have had on the population. So now I think we have come to the end of this webinar, and I'm thankful for the distinguished panelists, Professor Vajira Disanaika, although he was unable to come and join us in person, Mr. Barry Rabner, Tony Singaraya, and Mr. Anup Singh. I would also like to thank all of you who participated today and hope you will take part in the next webinar that we have planned on the 28th, which continues this discussion, bringing in further insights about being successful as a startup and digital health. And I take that suggestion, Tony, you made, that we probably be able to invite all the participants and others who are interested to join us with regard to the suggestions that you made in a special webinar in between as well. Now, I have some more information that I would like to present to you. If you need now, Barry and Tony and Anup all suggested in terms of information, we are open to providing you with that if you need any. So you can communicate with the PFIA through info@pfiaglobal.com, which is dedicated for the communication process. And also, please visit the awards.cwcdh.org for details on awards and for submissions. And as you go there, you will see that there are 5 categories on health tech, ecotech, nutritech, edutech, and fintech, representing the social determinants of health as well as the health tech category alone. And you can submit your applications through that. There is also another special category for COVID-related tech that came up in the past. And I'm sure there are many who are interested in submitting their products, because these innovations both have frugality as well as technology that would have manifested because of the pandemic and because of the situation that we had to undergo. Now, the video link for this webinar will be shared with all of you in due course. Now, with that, we close this session, and thanks again for taking part, and have a pleasant day. Thank you very much.
Thanks, everyone. Thank you, Pandala.
Thank you. Bye-bye.
Thank you, everyone. See you, everyone.